Dr. VijayaBhaskar, Masters in Orthopedic. Today we'll discuss about orthopedics and its other problems. There are many problems. Bone and joint is the more concern to the orthopedic department and associated with muscles, tendons, nerves, arteries, which are close to the bones, joints. So obviously we know about the problems in bones like fractures, tumors, infections of the bone, and then there is a various degenerative changes, and then there is a various arthritis of the bones and joints, you know. But what is the other problems in the bones are related to soft tissue. There are soft tissue problems like there is a bone, there is a tendons which passes in the hand. The tendons passes in a various other bones and joints, where there is a tendinitis, and means there is a inflammation of the bone. That is one possibility. Second possibility, the inflammation of the tendon. That is the one possibility. There is a decurrence disease, is nothing but the tendon which is passing through the tunnel of the distal end of the radius bone, which is being blocked, or the thickening of the fascia over the tendon causes the frictional pain. That frictional pain causes the pain at wrist joint, especially on the bone. So that is called a decurrence disease. And then there is a carpal tunnel syndrome. The carpal tunnel syndrome is nothing but the tendon which is going, the median nerve and the tendons in the tunnel, which has been compressed by the fascia thickening, and that is also called a carpal tunnel syndrome. And then if you see the elbow, where there is a bursa in the olecranon process, where the bursa which lies in between the bone and tendon or muscle, which helps to movement of the joint, that bursa which gets infected or sometimes inflamed because of various causes, and that is called bursitis. And then you see there is a tennis elbow and golfer's elbow. The tennis elbow is more often you see it in the medial side of the elbow, where the muscle attachment, the acting muscles of the forearm and the hand arise from the medial epicondyle, where the tear of the attachment of the medial epicondyle of these muscles at the epicondyle or at the end of the medial side of the bone, which gets irritated or inflamed, or there will be a tear in the attachment. So that causes the tennis elbow or the flexus elbow. The other side of the lateral aspect of the elbow, their epicondyle or distal end of the bone attaches to the hand and forearm muscles, which possibility of tear in the attachment, or there is an inflammation or irritation, leads to golfer's elbow, or the extension pain in the medial aspect and flexion pain in the lateral aspect. These are the two reasons where you see the pain, you know. And then you come, there is a biceps muscle is there. Then there sometimes in heavy people, the biceps muscle gets tear, that causes to the pain, the inflammation of the pain. Then there is a supraspinatus tendinitis, the tendon which passes over the shoulder, which is most powerful for the abductor, gets inflamed or sometimes calcified, or there will be a tear in the supraspinatus tendon. So that also leads to the pain. And then there is a periarthritis of the joint, where there is a capsule of the joint get inflamed in diabetic patients, which causes the pain in the joint.